Hi, my name is Bob Lebzelder. Welcome to Perspectives. Tina Stasiewski is our guest. She is Vice President of Business Development for Ashtabula County Medical Center. And I just thought of something, Tina. Hold on. Okay, got to bring you on speaker. Say hello.
Hi.
Okay, that's working good.
Okay.
Is the Ashtabula County Medical Center, is it still the largest employer in the county?
We are the largest private employer in Ashtabula County, yes.
Right. So when things impact ACMC, they impact a lot of people, not just employees, but of course everybody that, patients at ACMC.
Yeah, I would say that's an accurate statement, definitely.
Okay, I want to talk a little bit about the ransomware, which is going on for more than a month now. Must have caused a lot of problems. Somebody has taken over holding data for ransom, and that has resulted in a lot of changes and work. Can you tell us, as far as you can, how things are going with that? How is that impacting people right now? Can they go to their doctors at like ACMC in Conneaut or Geneva? And what's going on there?
Sure. So the first thing I'm going to say is that I am not going to verify or deny any association with ransomware. Yes, we have had a cybersecurity incident that led to a technical disruption. But as part of an ongoing investigation, it's very important that we be careful, not just from ACMC's perspective, but from the community's perspective, what labels we attach to what the hospital is experiencing right now. But all provider offices are open in all of our locations, so patients can see their doctor. The providers and all of the hospital departments can safely view patient information in our electronic health record. We do continue at this point to use what we call downtime procedures, which is basically the way we used to do things before we had an electronic health record. We would use downtime procedures throughout the year when there was a power outage or when we were doing a system upgrade. So staff, caregivers are accustomed to these. This is just a longer period of time to go back to the quote-unquote old way of doing things. All of our satellite offices, as I've said, are open, but we are not at this point offering the ancillary services. So lab and radiology are all being done here at the hospital.
So you can have them done, but you just can't have them done in Conneaut or Geneva, whatever. You have to go to Ashtabula.
Correct.
Okay.
We're hoping within the next couple weeks we're going to be able to extend those back out to the satellite locations, but for right now we're asking all patients to come to the hospital for those services.
This has been going on a long time. This has been going on a month. You guys must want this nightmare to be over.
It's a complicated process, and what I think is probably also important for everyone to understand is it's not one system that is our system. There's a separate lab system and an imaging system and billing systems, and all of those need to be safely reconnected to the network. And that doesn't happen overnight.
Right.
It's a step-by-step process, and we are being very methodical in how we do that and in what services we resume and when we resume them, all in the name of patient safety. And I think one of the things that we are most proud of is that throughout this disruption, patient safety has not been impacted.
And their data has not been out there? I mean, private information about people?
Yeah, based on our investigation, there's no evidence that any patient data has been accessed.
Okay, that's important. And not just health records, but financial records too, I would think.
Right.
So besides this, with the problems with the computers, there's also COVID, and how is that still impacting? Like if I had to take my wife to ACMC or a child or something, could I stay with that person, or can one person stay, or does everybody have to drop people off and leave them, or how does that work?
Sure. And probably the interviewer's worst answer is what I'm going to give you, and that is depends. So, for example, if you are a patient coming to our emergency department and you're coming for something that is not COVID suspected, then you can have one adult with you. Pediatric patients can have both parents with them. We are not at this point allowing visitors for inpatients. We were getting to a point where we were going to allow that, and then cases in the county started to increase again.
Yes.
And just out of an abundance of caution, we're not going to allow visitors at this point. And I just want to say that decision is not an easy one for us to make, because we truly do understand how difficult that is for the patient and the family. And it's difficult for our caregivers also, because they know what that connection with your loved ones means to you as a patient. It has been exceptionally difficult for every caregiver on the inpatient unit to know that family and friends aren't able to come see the patients at this point.
Well, you see these stories about people that they left their mother off at the hospital and went to park and thought they could come in and see her, and that was the last they saw her because she died of COVID or something. I mean,
I honestly hadn't heard of any stories.
I'm not talking about locally, but I've heard that across the country.
Oh.
So it's something that it's impacting all over. It's certainly not just an ACMC thing.
Right.
But it sounds like here you can one person can stay
with an emergency department.
Right.
Yeah.
Okay.
And then we do make compassionate exceptions for end-of-life situations for inpatients. If you're coming to a physician appointment and your physician has determined, based on your physical limitations, mobility challenges, or maybe your cognitive abilities, that you as a patient need to have somebody with you, that exception is also being made. So it's not a hard and fast no. It kind of is case by case, but everything we're doing around COVID is the same that we did in March, April, May. It's all about patient safety and caregiver safety and safety of the visitors that do come into the hospital, that limited number. The fewer people you have in a space, the less chance there is of transmission of a virus by somebody who is asymptomatic.
Right. I will say that a couple months ago I had to take a relative to ACMC, and I got to stay with that relative. And all I had to do was stand on a mat to have my temperature taken. So it was not a traumatic experience whatsoever. So let's go on to some more progressive things now, maybe a little less doom and gloom. You have some new programs at ACMC, awards, whatever. Tell us about some of that stuff.
We were recently awarded from the American Heart Association the Gold Plus recognition under their Get With the Guidelines program. And what that is recognizing is our stroke protocols. So the Gold Plus specifically recognizes that patients at ACMC who are exhibiting stroke symptoms are receiving the most appropriate treatment according to nationally recognized evidence-based guidelines. Mm-hmm. We were also then named to their Elite Honor Roll as a sub-recognition of that Gold Plus, and that's about our performance metrics from a time perspective. So we've heard frequently, with heart attacks that time is muscle, because the sooner that your treatment begins, the less muscle damage there is during a heart attack. The same is true with stroke. The faster treatment begins, the faster you're able to have that clot-busting medication, the less chances you have of long-term disability, I guess is probably not the word I really want, but that's what's coming to my mind right now. Long-term effects of a stroke. So, we are a primary stroke center. There's a team that when, if you are coming in by an ambulance squad, there's a team. The code comes across before the patient hits the door of the emergency department, and you have respiratory therapists, pharmacists, doctors, the lab technicians, everybody's standing there, radiology is standing there waiting for that patient so that treatment can begin immediately.
So, yeah, I just read something the other day about like 70 isn't the 70 it was years ago. It's because there is so much more going on, so much more to treat patients these days, that the life expectancy has gone up and all.
Yeah, and healthcare advancement it's amazing. My mom worked for heart surgeons in Erie for most of my life. I think she started with them when I was 8 and retired. I don't know how old I was, but I think she was there for 32, 35 years. And when she first started, people were staying in the hospital with open heart surgery for weeks. And by the time she retired, it was days. So, yeah, the advancements that come along every year in providing treatment for a variety of healthcare situations is pretty phenomenal.
Yeah. My wife just had her gallbladder out, and she was out working in the garden the next day, and I was talking to somebody else that had pretty much the same procedure but a few years ago, and she was just in agony for weeks. She couldn't wash her hair, she said. So what else?
I'm glad that your wife did so well with it. The other thing that I want to share is that we have recruited 7 additional physicians so far this year to Ashtabula County. Dr. Zimmerman is a primary care physician who is in our Jefferson office. Dr. Sharma is an endocrinologist, which we have not had a full-time endocrinologist in Ashtabula County for at least the 16 and a half years that I have been here, and probably longer than that. We also had Dr. Shakya, who is a pediatrician, join us. Dr. Ekman is a pain management specialist. Dr. Du is a general surgeon. And then we have 2 additional primary care providers, Dr. Fakalade and Dr. Kwan. They are both seeing patients in our Ashtabula office. And in the near future, Dr. Fakalade will be spending a day or 2 down in our Orwell office as well to expand access to primary care to our South County residents.
If people are interested in seeing one of these doctors or learning more, is there like a website that they can go to and find out where they have office hours and in what area?
Yes. So if you go to acmchealth.org, and then you will see options for find a provider. You click on that, and you can either search by the physician name if you happen to know the name, or you can search by specialty.
Okay, I would think searching by specialty would be pretty popular.
Yes, it is.
People don't like to have to go to, Erie or Cleveland or whatever if they can help it for health care.
Mm-hmm. And Ashtabula County we rank our ratio of primary care providers to residents is higher than both the state and the national average, and that's a problem. Primary care is your foundation for health. They are your partner in your overall health and well-being. So we as an organization have made a substantial commitment to expanding access to primary care and bringing as many primary care providers into Ashtabula County as we can. And to have 3 join in the first 10 months of the year is a pretty good result.
Right. I know there's people that they're looking for some place to live, and they look at Ashtabula County, and that's one thing they see is that I've got this condition, and how well can I get treatment?
Yes. And it's also one of the things that companies, as they're looking to relocate or expand, they want to know what the healthcare base is, because they're going to have employees that need to receive healthcare. So we're proud that we have such a wide scope of services. And, we've been here for over 115 years, and our plan is to be here for at least another 115.
Excellent. Tina Stasiewski, thank you for being our guest today on Perspectives.
You're very welcome.
All right. Thank you.
Take care.
Bye.
Bye.
I'm Bob Lebzelder on Perspectives.